Hello, everyone. Welcome to week 11. I'm Dr. Pauline Stolzner, and this week we will be focusing on legal and ethical boundaries in nursing. As nurses, we live in this space between ethics and law. Sometimes they align, and sometimes they don't. Ethics tells us what we should do, and law tells us what we must do. The challenge comes when these two paths conflict. How do we protect patients, ourselves, and our license? Let's begin by revisiting our ethical compass. The ANA Code of Ethics helps guide our behavior, especially in morally complex situations. Key themes include patient dignity, advocacy, accountability, and self-care. Provision 5 reminds us we owe a duty to ourselves, too. Our health, safety, and integrity matters. Which ANA provision speaks to you the most in your current practice? Legally, nurses must stay within scope of practice, obtain consent, maintain confidentiality, and document accurately. These rules protect patients, but they also protect us. Violating these duties can lead to lawsuits, board action, or loss of license. But most situations aren't so black and white. Ethics often blurs the lines. Family wants CPR, but the patient has a DNR. A patient refuses life-saving treatment, but their capacity is in question. You suspect abuse, but the patient begs you not to report. These moments test not just your knowledge, but your values. What's one ethical gray area you've encountered in your nursing practice? Legal actions aren't always ethical, and ethical actions aren't always legal. For example, denying care to an undocumented patient might be legal, but it likely violates your moral code. When in doubt, consult with supervisors, ethics committees, risk management, or trusted colleagues. Now let's talk about boundaries, because they're where ethics and professionalism collide. Boundaries aren't about being cold. They're about protecting the therapeutic relationship. Dual relationships, over-disclosure, favoritism, or inappropriate communication all blur the line. Healthy boundaries preserve patient autonomy and prevent harm. Where do you see boundary lines being tested in your work setting? Ethical and legal violations can result in serious consequences: discipline by the board, loss of trust, emotional distress. But the impact on the patient can be even greater: loss of dignity, re-traumatization, or harm. Reflect regularly and seek feedback. It's how we stay grounded. Let's explore a scenario where these issues come to life. A nurse is texting a former patient about personal matters. At first, it seemed harmless. Now it feels blurry. What are the risks to the patient, the nurse, and the profession? How should you respond if you observe something like this? What would you say to a peer if you noticed a boundary was being crossed? Have you ever felt torn between doing what's right and what's allowed? What supports do you have for making ethical decisions in your setting? How do you take care of yourself when ethical challenges feel heavy? Legal and ethical nursing isn't always about having the answer. It's about staying curious, humble, and committed to doing what's right, even when it's hard.